substance related disorders. Please go with subtitles. Ingestion of any drug which can be abused, including prescribed medications and alcohol, as well as illicit substances. So it includes purposeful ingestion of a substance with goal of altering one's internal state. So they feel that they are making themselves happy. That is the main goal. So SRD is characterized by repeated use or abuse of substance that results in a pattern of behavior, physiological symptoms that have negative effects, often devastating effects on person's ability to function in everyday life and on interpersonal relationships. So entire the relations will be gone if they are out of control due to substance related disorder. Decreased or low levels of ingestion pattern is called abuse. As the pattern progresses with increasing tolerance and dependence, then it leads to substance dependence disorder. So first thing is always abuse. Abuse leads to next stage is, so abuse, tolerance and dependence. That order we have to remember. The classification of these drugs can be various, like alcohol, nicotine, etc. And the overall signs and symptoms can be psychoactive substances affect thoughts, emotions and behavior. And these in turn leads to intoxication and poisoning. A temporary syndrome in which a person exhibits impaired judgment, mood changes, irritable, slurred speech and decreased coordination. LSD causes intoxication, hallucinations and perceptual disturbances or distortions, we can say. Commonly we have two types of substance related disorders. They are substance use disorder and substance induced disorders. Okay, use and induced, two types. Then coming to first one, use disorders. Initially the substance dependence is intense craving for substance. He is addicted and develop tolerance, withdrawal and compulsive drug intake. So in this substance use disorder, two we have to mention, that is again substance abuse, and again on the when it progresses, keep on going substance abuse, then it leads to dependence. Okay, these two comes under substance use disorders. Then so for tolerance is a person has to use more and more substance to get the same effect. So daily increasing the dose is tolerance. Withdrawal refers to physical symptoms which patient gets after stopping the use of these drugs, these substances. So the symptoms which we see after stopping are called as withdrawal. These are also problems. Okay, means these are also creating problems, withdrawal symptoms. That also we have to manage. Coming to compulsive substance use is drug seeking behavior. So compulsion, they have to take it to even avoid these withdrawal symptoms. And substance abuse is recurrent and significant adverse consequences related to use of substance. Okay, so these are the few points related to substance use disorder. Coming to second one, that is substance induced disorders. Is ingestion of different substances lead to serious behavioral, psychological, physiological substance intoxication and are disturbed three aspects. Okay, PAT we can remember, that is perceptions, attention and thought. These three are adversely, means badly affected, and we need to have 3 or more symptoms for at least 6 to 12 months to be called it as substance related disorders. Coming to in detail, alcohol related substance related disorders means SD we can say, or SRD. Ethanol is only alcohol intended for human consumption. It's present in beer, wine, distilled liquor, and the percentage of alcohol differs from one to another. Okay, beer will be different and wine will be different. Alcoholic beverage has alcohol, then this will be having altered effects on central nervous system that leads to impaired motor skills. Intoxication occurs when the alcohol content of the blood is 0.09%. So then we'll call it as intoxication. Excessive use leads to abuse, dependence and alcoholism, intoxication that in turn leads to related accidents and crisis. Amphetamines. These stimulates central nervous system, heart, and moderate doses leads to wakefulness, alertness, increased mood tolerance, and develops rapidly, gives more intensive effects. The high doses leads to nervous system, digestive system, and confusions, palpitations, increased BP. Then the best example is methamphetamines. Okay, this is one which causes bad, very negative effects. Example of movie, Vikram's movie, Incocked. Okay, he will be giving that amphetamine injections, and that person will be very active for some time, and then will be becoming very like weak. Caffeine can be addictive and mind altering properties, has high doses, anxiety, nervous intoxication, excitement, insomnia, restlessness, increased heart rate, tolerance and withdrawal symptoms occur. Cannabis used in the form of marijuana. So best example for cannabis is marijuana. It is nothing but solidified resin of cannabis plant. Then I think it is ganjai Telugu. Okay. Then marijuana impairs motor coordination, perception, and affects short-term memory. And the treatment involves relapse prevention, social support groups. Okay. So far we have discussed alcohol, amphetamines, that is methamphetamine, cannabis, that is marijuana, and next is cocaine. It's a drug from leaves of coca bush. It stimulates CNS, increased heart rate, increased BP, increased temperature, decreased appetite. Crack, C-R-A-C-K. Crack is more potent form of cocaine, highly addictive. Okay. So in cocaine, we have to remember crack. Most all these areas, all the rates will be increased. That we have to remember. Okay. Increased HR, RR, respiratory rate, BP. These symptoms always increasing. Okay. And other systematic symptoms also. Coming to hallucinogens, best example is LSD. The naturally found hallucinogens are mescaline and psilocybin. So commonly the natural hallucinogens are in some countries or some communities are used in many cultural ceremonies for hundreds of years. The abuse of hallucinogens increases the respirations, cardiac collapse, and psychotic behavior. Then coming to inhalants, volatile substance like gasoline or spray paints can be used to produce the changes in perception that leads to decreased social or occupational activities, and mostly these are used by youth due to their accessibility, easily available in inhalation forms. Coming to nicotine, which is very common, found in tobacco, and it acts directly by stimulating the central nervous system, which are sensitive to acetylcholine, the best neurotransmitter. Here also the heart rate, BP are increased, and increased need for oxygen because the effect is severe on lungs, chest pain, heart attack in atherosclerotic patients, and the smoking is commonly habitual. That is a problem. Okay. Even now it is available in the form of chewing also. So either in smoking or chewing form, which badly affects CNS by altering over the acetylcholine. Coming to opioids, the best examples are morphine and heroin, and the naturally available is endorphins, which are formed even sometimes when we feel happy or excited or exercises. Okay. Then morphine, heroin are derived from the plants of opium poppy, and this causes mood changes, sleepiness, mental clouding, constipation, decreased respiratory center of brain, withdrawal reaction is very severe. PCP or pencyclidine, synthetic chemical causes disorientation, hallucinations, dissociation from the environment, irreversible depression. The treatment pattern is biological treatment and detoxification. Antagonists also can be used to reverse the effect of these drugs. Then drug maintenance, socio-cultural treatment, and then in this aspect we have to use community preventing programs. Okay, just motivating or educating them not to go for these substances. So these are the few points related to substance related disorders. Thank you.